DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, thanks for joining us today on DocTalk. I'm Dr. Dan Thompson here at Kansas State University's College of Veterinary Medicine. We're bound to have a great show. Dr. David Rethorst from the Beef Cattle Institute at Kansas State University is with us, and we're going to talk about proper injection sites for your cattle. Very important topic, very timely topic. Thanks for joining us and enjoy the show.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
David, welcome to the show.
Glad to be here, as always.
Folks, this is Dr. David Rethorst, and Dr. Dave is an experienced practitioner. He spent 35 years practicing cow-calf production medicine and individual animal medicine in southern Nebraska, northern Kansas, and is now the Director of Outreach here at the Kansas State University's Beef Cattle Institute. We're proud to have him, and we're going to talk about injection sites.
One of my favorite topics. Been involved with it a long time, Dan.
Yeah, you've been involved with beef quality assurance and whether on a state or national level for decades.
Since the tablets came down off the mountain.
Well, let's talk a little bit about injection sites and just kind of the history of how we got to this point, and dial back to the day when maybe we didn't understand where and how we should give these injections.
Okay. Well, you know, you go back to when I graduated from veterinary school. When we were processing cattle, we'd give our viral, and if we were given a vitamin A, we'd give those in the top butt like this, and we'd step up to the neck and we'd give our clostridial. And then, you know, in about 1992, the steak purveyors nationwide started screaming that those top butts, 22% of them had scar tissue or abscesses in them, and came to the beef industry and said, what can we do about this? So that's when we went to work, and we moved those injection sites from the top butt to the neck, and by 2002 those top butts had less than 2% injection site blemishes in them. So great success story, but that's why we give injections in the neck, so we aren't putting them in those sirloin steaks.
Yeah, and you know, one of the things you said there that kind of stick with me too, and in this day and age of antibiotics and animal welfare and food safety, you know, the meat purveyors came and talked to the cattlemen.
Absolutely.
You know, we've gotten away from the talking to each other, and we just send out a press release and hopes the other group reads it and pretty much offends everybody.
Right. We put it on Facebook or a press release, or we put it out on Twitter, and you know.
And I think
let's communicate.
Yep. Let's one beef.
Yes.
You know, whether you're selling it to the consumer or whether you're raising it on the hoof, we're all in one beef industry. And this topic, this proper injection site topic, is a prime
example of why we need to communicate.
And how we can communicate
right.
and solve a problem.
Right. That's a wonderful success story.
Yep. And so, you know, as we get through there, we move then the injection sites from the round to the neck.
Right.
And we have that, you know, kind of area. Describe the area of the injection site.
Well, that area The top of that is 2 inches below the top of the neck because we need to stay below that nuchal ligament that lets that calf hold its head up so its nose isn't down on the ground. The back of that zone is just in front of the slope of the shoulder, and then the bottom of that triangle is the vertebrae in the neck. They're down low, but we certainly don't want to be bouncing the needle off of those vertebrae. So we've got something this long and at the back of it this high on most calves, and we can get a couple, 3 injections in there.
Perfect. We're going to take a break. When we come back, more on injection sites with Dr. Dave Rethorst.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Jonathan Angel wanted to be a veterinarian since boyhood. He grew up near his grandparents' farm where he spent much of his time. Completed the Boy Scout Veterinary Medicine Merit Badge in high school and later shadowed the doctors at Sugar Creek Vet Clinic. After graduation, Jonathan will be joining this practice, and he and his wife will also move back to his grandparents' farm to raise polled Herefords.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey folks, welcome back to Doc Talk. It's Dr. Dan Thompson here with Dr. Dave Rethorst, and we work at the Beef Cattle Institute at Kansas State University, and we're tickled to death that you joined us today to talk about something that we all do is injection sites. And you know, they always told me that, do ordinary things extraordinarily well would be a good motto towards work. And these injection sites and processing is a quality event, not a quantity event.
Right. Processing is not a timed event, and we need to do it right, and when we learn to do it right, then it becomes faster, and then we pick up our speed.
Yep. So let's talk about, okay, so we've described our injection site triangle.
Yes.
And so now we're going to talk about some of the different injections that we'll perform. And I don't think people understand, but isn't it extra label to an antibiotic if you don't use the injection route of administration that it's labeled for?
Absolutely. If it's labeled to be given subcutaneously, it's extra label if it's given in the muscle. To do that, you need, under AMDUCA laws, written prescription from your veterinarian to do it that way. But the fact remains, follow the label.
So let's tell our viewers why it's important. If I'm supposed to give it at the base of the ear and I give it sub-Q in the neck, or if it's supposed to be at the base of the ear and I give it intermuscularly, or vice versa, It can change with the pharmacokinetics and the withdrawal times, right?
Right, it changes the withdrawal times. If we take a product that's supposed to be given at the base of the ear, for example, and we give that sub-Q in the neck, it greatly extends the withdrawal time on that, because when it's given in the base of the ear, that withdrawal time is determined on the fact that it's injected into fat there at the base of the ear, and when we put it in connective tissue subcutaneously, it stays there much longer.
Yep. And that ear's not edible tissue.
That ear is not edible tissue. That's correct.
You know, and I think that's the big thing that people need to understand is, you know, if it's labeled this way, use it this way, unless your veterinarian has talked to you otherwise.
Right.
And the reason isn't because we're trying to make your life more difficult. It's actually trying to make your life simpler, because we don't want the people with the black sedans, tinted windows,
black helicopters,
no hubcaps, AM, FM radio, showing up and putting you on the FDA's residue list.
Right. Those lists are no fun. I've been there with the feed yard.
Yep. And so we want to make sure, and I think that's the reason why, if a product's labeled in a way, unless you have a really good reason, and especially unless you have written extra labeled drug from a veterinarian, you need to use it in the manner in which it's labeled.
Absolutely.
Well, we've got about 30 seconds here before we go to the break, and so what are the 3 types of injections that we're going to talk about when we come back?
Okay, when we come back, we're going to talk about a subcutaneous injection or just underneath the skin. We're going to talk about an intramuscular injection, which is pretty self-explanatory. It is in the muscle. And then we're going to talk about an intravenous injection.
Perfect. Thanks for watching Doc Talk. More in a minute.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just 1 trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, 1 hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We are having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multacida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
True Test Group, weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Folks, welcome back to Doc Talk. Dr. Dan Thompson and Dr. Dave Rethorst. We're from Kansas State University, and we are at the Beef Cattle Institute. Glad to be with you today. Glad to be talking to you about proper injection sites in your cattle. And Dr. Dave, let's jump right in. We've got subcutaneous, intermuscular, and intravenous injections. Let's jump right into probably the most common one now. Most products are labeled subcutaneously or sub-Q, SQ, whatever you want to call it.
Right. And that injection means we're giving that in the connective tissue between the skin and the muscle. And, you know, in the past, we've talked that you wanted to use a tented, two-handed tenting technique to make sure that was given right. And you reach in with one hand and pull the skin out and give the injection. But you've got two hands in the chute. There's some work comp issues. There's some product safety issues with certain products. And so what I teach people anymore is, you know, let's just do one hand, but go in at about a 15-degree angle. Like this is the neck. I want to go in pretty flat using a 5/8 or a 3/4 inch needle. And once that needle hub hits, then I kind of relax my hand, and if you watch, that syringe will slide back 1/8 to 1/4 of an inch, and that needle pops right up in that sub-Q space, and you can give an injection, and it's sub-Q, and you're not in the muscle at all.
Yeah, and I think on the needle length, you know, I've even gone half-inch,
Right.
half-inch, 5/8, and then, you know, sometimes 3/4, but trying to keep that shorter needle to prevent going into that fascia or going beyond that sub-Q space is why we do that. But I think your angle, I think your needle length, but more importantly is what you're saying, check. It's pretty easy to feel if you're in that space between the sub-Q and the fascia or the muscle.
Right.
And
just slow down.
Slow down and make sure you're in there. And then when you deposit that product, you'll get a little bleb.
Right.
And so needle size. One of the things that I think I get a question on, you know, what gauge needles are you using?
Well, on baby calves, I like to use an 18 gauge needle. Now, if we're doing one of these rope and drag brandings and those calves aren't restrained quite as well, you know, I'll go ahead and use a 16 gauge needle on those just to make sure we don't break a needle off. But, you know, once we get to weaning and on into mature cattle, I'm using a 16 gauge needle pretty routinely.
Yep, and I would tend to agree with that. So on sub-Qs, we're going to go with half-inch, 5/8, 3/4 inch needles, 16, 18 gauge, and we're going to slide in at an angle, make sure we're in the sub-Q area.
Right.
IM?
Well, let's back up on sub-Q just a minute. You know, a lot of people think you can give a sub-Q injection behind the point of the elbow, and they kind of ignore our injection triangle. Well, the reason we don't want to be behind the point of the elbow is that muscle there is real tightly adhered to the skin, and you can't give a true sub-Q injection. So you end up with infection a lot of times. So I would encourage you to get those products into the injection triangle. We have one product on the market that on their label it shows injecting behind the point of the elbow, but that isn't right.
Gotcha. Well, we're going to take a break. When we come back, we're going to talk about IM and IV injections with Dr. Dave Rethorst.
The BQA tip of the day, sponsored by Beringer Engelheim Vetmedica Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation out of Great Bend, Kansas. Today's BQA tip of the day, we're going to talk about heat stress in cattle. We especially don't want to handle cattle in the heat of the day to create undue stress on these animals, which in the end will reduce our production. As producers, we must do the right thing and process these cattle or handle cattle or do our brandings at the right time of day or move or ship cattle at the right time of day, early morning, first half of the day, to avoid these heat stress situations. We want to remind ourselves today may be 80 degrees, but if cattle aren't adjusted to the heat, it could be a heat stress day for them. It may not be 90 or 100, but again, if it's 70 or 80 and cattle aren't heat adjusted to it, it'll be a heat stress day for them. So keep that in mind each and every day as you're handling your cattle. Do the right thing, monitor your temps, the wind, the humidity, and don't inflict undue stress on these animals with heat stress.
it must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones, all they want to do is go to the barn, swing a rope, and be a cowboy. It's something, it's a lifestyle that we have, the way we make a living, obviously, but it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Dave Rethorst from the Beef Cattle Institute at Kansas State University. We're talking about something that Dr. Rethorst spends a lot of time in the state working with producers. Well, he's working all across the United States working with producers on beef quality assurance. And specifically today we're talking about injection sites that people may think is a very simple, easy thing to talk about, but it's something that we got to make sure that we continue to get right. As we talked about subcutaneous, let's move into the IM or IV.
Okay.
We won't talk about IC, intra-cow.
Intra-cow, right.
But we will talk about intermuscular and intravenous injections today.
Okay.
So let's go with the IM. What are we doing there?
Okay, IM, we're giving that product in the muscle. We want it deep in the muscle. There's not a lot of products that are labeled IM anymore. Most of them are labeled sub-Q. But if we are given a product, there's times, you want to give like a viral intramuscular, something like that. If I'm, using it intramuscular on a calf, I'm using an inch needle. Like on a weaning calf, I'd use a 16 gauge inch needle. If I'm intramuscular on a mature cow, I'm using a 16 gauge 1.5 inch needle, because I want to make sure I'm in the muscle where I get the absorption that I'm after.
So technique on IM, it's not going to be at that 15-degree
angle.
angle.
No, it's going to be straight in.
Perpendicular.
Perpendicular to the surface you're injecting into.
Okay.
You can be, using an 1.5 inch needle, you can be off a little bit and still get into the muscle belly, but you want to be basically straight in.
And I think it's important to understand that where we're giving that injection, between that vertebral column and between that nuchal ligament, that's muscle all the way across.
Absolutely.
So when we're given that, if we're too low, you'll know it.
You'll bounce it off the bone,
and we don't want to do that.
Right.
And
if you're too high, you'll hit that ligament, and you're going to have sore neck calves, and the product isn't going to work.
Exactly. So let's talk about IV.
Okay, IV. We occasionally still give some antibiotics intravenously on an individual animal basis.
Milk fevers.
The calcium, magnesium products, something like that. I like to use a 14 gauge 2-inch needle and make sure it's threaded down the vein, and that way I don't have trouble with it popping out. Some people use a 16 gauge needle, but again, it goes back to knowing the technique. Flunixin. is labeled intravenously. We could do an IV with a 16 gauge inch to inch and a half needle on that, and it's critical we bring that up. A lot of flunixin's given intramuscular, causes nasty injection site lesions. So when we're using that product, we need to be giving it IV.
Perfect. Well, thanks for joining us today.
Glad to be here.
And thank you for joining us today. Remember, always work with your local veterinarian. And if you want to know more about what Dr. Dave and I do here at K-State, you can find us on the web at www.vet.ksu.edu. You've been watching Doc Talk. We're sure glad you joined us. I'm Dr. Dan Thompson, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. Doc Talk was brought to you by Merck Animal Health, the science of healthier animals.